My name is Dr. Hyman, and I'm a board-certified plastic surgeon here in New York City. So a tummy tuck is also known as an abdominoplasty, and this is typically a procedure that is done under anesthesia. It's done to remove excess skin and fat from the lower abdomen. This procedure is a trade-off between a very dramatic result and a scar. So one has to be willing to accept a scar for this procedure. There's no way around it. It's really common that people come in asking, am I a candidate for a tummy tuck or liposuction? And they're very different procedures. Typically, I do liposuction with a tummy tuck, so you get the best of both worlds. But a tummy tuck is a much more extensive procedure than liposuction alone. After a tummy tuck, it's quite a large scar. It typically goes from hip to hip. A lot of people consider it similar to a C-section scar. It will fade over time. It usually takes about 6 months, 8 months before it really starts to fade. I typically put it lower than where a C-section would be. As long as the scar is low, it can be covered with underwear or a bathing suit and usually isn't an issue. Typically somebody who's just 10 or 15 pounds overweight is not a good candidate for an abdominoplasty. To be a candidate for a tummy tuck, you really have to have more extra skin than extra fat. A tummy tuck takes approximately 3 hours under anesthesia. We do this procedure here in our office-based surgical facility. Typically, patients stay for another 2 hours after the procedure just to recover and wake up. And so the entire process is the better part of a day. Usually a patient will arrive at 8 a.m. and go home approximately 1 or 2 in the afternoon. After a tummy tuck, one should expect to have approximately 2 weeks off from work and 4 weeks off from exercise. Generally, post-operative course is uncomplicated and we just see a little bit of swelling. Sometimes, despite the drain placement, patients can get a little bit of fluid that accumulates, and in this situation we call it a seroma. These can be drained easily in the office. Patients generally love their tummy tuck results, but the first few days after surgery, their abdomen's wrapped and they really can't see anything. So it's fun. They come in about 5 days after their surgery and we take a look at everything together, and usually there's tears of joy. After a tummy tuck surgery here at my office, you will be contacted the morning after the procedure. I'll answer any questions you have. I will also provide you with a cell phone where you can directly text me. Any questions go directly to me and I will answer them immediately.